we all sat around in November in front of a black and white TV set in the fraternity house where I lived, and my number came out 48. I had wanted to go into linguistics, but I also had thought about medical school, and obviously I didn't want to translate Vietnamese on the front line, which is what my colleagues ended up doing.
Wow.
For a war that I didn't believe in. So, it was a privilege to be in university, and then you get to, your question was, how did all this influence patient care and at medical school? I think when we're talking about access to care in those days, and again into my residency, things were simpler for us. We didn't have scope of practice issues. We didn't have all the regulations. I was trained in Northwestern where I went to be part of a team. We had the same social worker, same outpatient, dietitian, physical therapy, on-call clinic, and everybody on the team took care of the patients. I remember we did creative things to get patients medications that they needed. I did go to a free clinic once a week that was in a Hispanic community next to a part of Chicago called Cabrini Greens, which was a very impoverished area. I saw firsthand what patients struggled to get care. It was similar to a Charm City clinic here at Hopkins is for the medical students. Long-winded answer, I think all of us were imbued by issues related to challenges at the time with Vietnam War, with civil rights, the assassinations that occurred, the riots. And I think my classmates and I really just did things. We knew, we helped. We were creative in how we did things, but I can't remember, it was just the way life was. With regard to inequities for access to transplantation, especially kidney transplantation, I worked with a group at the School of Public Health to see if the material we were giving individuals was sensitive, culturally sensitive. What it turned out is that it wasn't the issue at all, that the major barrier was socioeconomic. People want to give, whether you're black, white, purple, or green. The problem is that they didn't know, they couldn't get through the hoops again for live donation. We're looking again at how we can get better education out to people, but reach out and bring folks through the hoops.
In the scope of your entire practice, you place special emphasis on building relationships with your patients over time. Why is this an important aspect of clinically excellent care?
Patients aren't textbooks. They don't follow descriptions of disease. They have goals that may not be mine. And so whenever I sit with a patient, I try as hard as I can to see the world through their eyes. The language they use may be different than my language. For example, I was talking with a gentleman on the phone who probably has trigeminal neuralgia. He was calling me to see if someone at Hopkins could help him. He was a friend of one of my patients. And I used the word pain. He said, but it's not pain. And he described the feeling, what I would call a neuropathic pain, but it's not the way he would use the buzz, the other words. It's very easy to take someone's words and think about them the way you would think about them and miss completely what they're saying.
Dr. Kraus, thank you so much for your time. That was a CLOSLER look.